We've had our finest moments and our darkest hours. Yet we pull ourselves back from the brink every time. We are a resilient people. We are Nigeria. And when we talk, we share our views on Top Radio 93.7 Citizen FM. A people united will never be defeated. This is our journey. We've had our finest moments and our darkest hours. Yet we pull ourselves back from the brink.
Give someone a chance. It is the way to make a difference every single day. Donate blood. Be a true hero. It is what we do. Join us on Citizen FM 93.7 every Thursday at 12:05 p.m.
Hello and welcome to Give Someone a Chance. This is a special program on Citizen 93.7 FM Abuja, dedicated to the promotion of voluntary blood donation as an act of compassion and public service. The program is proudly sponsored by the National Blood Service Agency, the government institution charged with providing safe, adequate, and quality blood and blood products for all who need them in Nigeria. Now, every day, thousands of Nigerians, mothers in childbirth, accident victims, and patients battling life-threatening conditions depend on donated blood to stay alive. Yet, the country faces a critical shortage, receiving less than half of the 2 million units required annually. Today on Give Someone a Chance, we shine a light on the life-saving power of voluntary blood donation, why it matters, how it works, and how each of us can be part of the solution. Welcome to the show once again. On Give Someone a Chance today, we will be looking at the importance of donating blood. And we have our guest in the house today, Sinteke Aliu. She is the Principal Scientific Officer, Department of Planning, Research and Statistics of the National Blood Safety Service Agency. Good afternoon,
Good
Sinteke.
afternoon. Thank you very much for having me.
It's a pleasure to have you in the studio.
Thank you very much.
All right, so you can join the conversation. You can join our live stream on Citizen FM. That's on YouTube. You can listen to us online on www.citizenfm.ng. And you can also follow us on our social media platforms, 3 of them on Facebook at Citizen FM Abuja, on Instagram at Citizen FM 937, and on X at Citizen FM 937. So, Sinteke, let's move on straight away. How severe is Nigeria's current blood shortage, and what does it mean for public health outcomes across the country?
Well, thank you very much for asking me. I would first like to just register my gratitude for being here at the station. I'm here on behalf of my boss, the head of my Department of Planning, Research and Statistics, by name Dr. Adam Dawood. So we're glad to be here to pass more information on blood and what it means for us as a people and as a country, Nigeria. So back to your question now. What we are actually experiencing in the country, like you mentioned earlier, you said we're getting less than half of what we require as a nation. It's actually more, it's below that actually.
Less than half.
It's below less than half. What we're getting is around 500,000 pints, and what the country needs is around 2 million, which represents just 10% of our population. That if we're working with with what we have as a population, because based on the WHO recommendation, it's that a country should be able to have at least 10% of their blood needs. Now, looking at our own population, that 2 million pints represents only 10%, of which we are not able to do that as a nation. What we are currently doing is 500,000. So that means we are having a lot of losses as a result of the inability for the country to be able to rise up to the challenge of providing the necessary amount of blood for us.
Yeah, we also understand that your service has also said that blood unavailability accounts for about 40% of maternal mortality and about 30% of accident-related deaths. What factors do you think contribute to these grim statistics?
Blood unavailability, like for us not to have that blood available, definitely you're going to experience a lot of fatalities where they shouldn't be. You know, that's the case. Another thing is why we do not have as much blood as we require is because the awareness is not ideal. We, as a people, we are very superstitious around anything that has to do with blood and blood donations. And one of the major crises following lower income countries like Nigeria now is the fact that most of our donors are paid. They are not voluntary donors, which means most people wait until there is a crisis before they begin to look for blood, because sometimes the hospitals do not even have enough to serve their patients. And when you go to the hospital, there's that requirement of, okay, do you have a donor? It's at that point that if you do not have, even the hospitals reach out to donors that are paid for it. And according to WHO recommendations, the best types of donors are the voluntary types, because you're certain that for anyone coming to donate blood voluntarily, he lives a healthy lifestyle, is very cautious about the general well-being and health of his person. So you're certain of the quality of blood you're getting from such a donor. But with paid donors, what they are doing is they know it's a source of resources. So they can't care less about their quality of health or the lifestyle. So they give that blood. And when they give it, you know, you can't guarantee or say the blood is adequate or ideal. So as long as you have a system where you're heavily reliant on paid donors or family replacement donors, because that's the system that we have working for us here in the country. It's either family replacement, that is, I have my relative can come and donate for me, or I pay someone. Because there are cases that because of the superstition around donations and blood and transfusions in general, people, even as family replacements, are reluctant to donate blood. They would rather get paid donors. And that's not the recommended path to follow according to WHO when it comes to blood donations and blood.
Okay, even though you've hinted on some of this, I want us to stay with the issue of voluntary, non-remunerated blood donation. And why is it considered the safest source of blood?
It's considered the safest because usually our voluntary donors, they know that they are voluntary donors. They know that it's important they are healthy. So they take care of themselves. They take care that they are not consuming anything that would jeopardize the quality of their blood. That is, drinking, smoking, living a high-risk lifestyle that would predispose them to TTIs. TTIs, transfusible infections, transfusible infections. That is HIV, hepatitis B, hepatitis C, and syphilis. Yes, so that is why voluntary donation is the best. These donors are very particular about how they live.
Okay, tell us about how safe this blood that is donated is. Is it properly stored? Because some people, especially people who have no idea, how do the National Blood Safety Agency do this?
Okay, we run a system of before you donate, we do not discriminate. Anyone can come in and donate. So when you donate your blood, the blood is taken and stored properly in blood banks, you know, where the temperature is monitored and controlled. After that storage process, it is then screened, properly screened. When it's properly screened, it is labeled. When it's labeled, and throughout this whole process, there's a documentation process that follows it, which means if I am Mary, for example, I donated blood with Ruth on the same day. That is 2 pints collected at the same time. They are labeled differently. Every blood unit has a unique number and a barcode. So that barcode is taken across the various departments that are handling these blood units, from when you are registered to when you are bled to when the blood is taken to the lab for testing and screening to the labeling. So there's a strict documentation protocol that is followed with each pint of blood and a barcode. So there is no case of, okay, Mary's blood is switched with Ruth and Ruth's blood is switched, that we don't
just
have
like
a case.
we watch in the movies.
No, that because for a mistake like that to occur, that can mean the life of someone. And aside that, the blood bags are collected. The blood is collected in blood bags, but then we also have tiny 10 ml bottles as well. The pilot bottles are collected to accompany the blood bags as well. So what is being handled is really those tiny pilot bottles. We call them pilot bottles. Those samples in those bottles, it's what is used to process. So at the end of the screening process, because very little amount of blood is required for the screening, at the end of the screening process, then the labeling is when the blood is brought out and then the blood bags are labeled. So it's not as if the blood bag is moving, across departments, because that presents a situation of maybe contamination and maybe improper handling, and temperature is not being controlled, because all these tiny little factors affect the integrity of the blood.
Okay, I know that earlier you said something about superstitions and myths about blood donation. What are some of those things that you encounter daily when it comes to getting people to donate blood?
Okay, one of the major, when you go for blood drives now, one of the major reservations people have is, I hope you people are not going to do something diabolic with my blood. Where is my blood going to? Because blood is life. We all know blood is life. Even on a spiritual, perspective, blood is life. So that, no, I can't give my blood, because this is my life. So how sure am I that you people are not using or selling it to some funny people? So I don't trust you people with my blood, but that's never the case. For every blood unit that is not even accessed from us by hospitals, and the blood happens to expire in our possession, there's a protocol and a process for discard, which involves incineration. So there are inventories, there's documentation to show that for every pint of blood is well accounted for. So there's no foul play anywhere.
All right. Before we go on the break, the DG once said that if only 1% of adult population donates regularly, Nigeria could meet its blood needs. So what are the strategies in place by your agency so far to mobilize and even retain voluntary donors, since those are the best set of people to target?
Yes. So for voluntary donors now, we know voluntary donors are donors that are people that, feel they can donate, so they walk into the office. Those are voluntary donors. Now, the means that we have on tracking and ensuring that these donors are not just one-time donors, they're repeat donors, is we have records that we keep for each donor, their biodata. So we call them, we remind them when they're due for their next donations. We call them on their birthdays as well, as a means of keeping in touch with them. And when it comes to the efforts that the organization puts to recruit donors, we have awareness that goes on around different states where we have offices. So we have an awareness exercises that is...
What is the benefit of donating blood?
Can you hear that?
Sorry,
can you hear me?
Yes, speak up a little bit.
I said, what are the benefits of donating blood? What are the benefits to individuals or whatever? I just want to know, why do we donate blood?
All right, you didn't tell us your name, ma'am. Where are you calling from, please?
Okay, my name is Zainab. I live here in Abuja.
Okay.
Yes. I just had your program, so I want to ask a question.
All right. Thank you so much, Zainab. We got
Yes.
you. Zainab wants to know why we need to donate blood. I'm sure you just know that because I don't want you to miss your train of thought before the call came. So, okay, Zainab, thank you so much. Just stay tuned.
Thank you.
She's going to
Thank
answer your question.
Okay.
So you
Okay,
can
thank
you can conclude your thought.
Okay. All right. So the organization also have some school-based programs for primary schools, secondary schools, and also for tertiary institutions. We know that for blood donation to begin, you have to be at 18 years before you can begin donation. So the agency goes even before people get to 18 years. So they start their blood donation clubs from primary school to catch them young before they get to that age. Usually when people start donating at a very young age, you find research has shown that these people tend to have families that also carry on the culture of blood donations.
Okay.
So currently we run school-based programs and tertiary programs for blood donors or people that are interested in becoming blood donors.
Okay, you can answer Zainab's question now.
Okay.
Why do we donate blood? I'm sure you spoke about that, but I don't think she was listening.
Okay. Blood donation now has benefits on, let me say, 2 levels. For the donor, for the recipient, that's the person that ends up receiving the blood, and then overall for your society or your community. Now, for you, the donor, it reduces your risk of heart disease. Now, how does it do that? By reducing your iron levels. For every time you give blood, it's a reduction in your iron levels. That process of reducing iron levels stimulates your blood. It notifies your system that something has just left you, so you need to produce new cells. For the fact that new cells are coming up in your body, it rejuvenates your other internal organs. You have fresh blood cells now going around in your body, so it gives your overall health a more rounded, status. And then again, if you go in for like a blood donation, you can get very like a minimal medical check, because even before they take your blood, they do like check your blood pressure, checking your blood level, those minor things. Some people come to the office for blood donation, they're not even aware that they have a high blood pressure. So for those people now, the blood donation or their willingness to come in indicates another health issue that makes them go to the hospital for further checks. And then the biggest reason for most of our voluntary donors is to feel like they're doing something to help somebody. The altruistic reason, a sense of selflessness. So I know that my blood is saving somebody. Now for the recipient, you're saving that person's life. And that is something that the person cannot thank you enough for. And there's no money that would ever be enough to give. You're saving children with anemia, anemic kids. You're saving mothers that, due to pregnancy or pregnancy-related complications, bleed during deliveries and the rest. And you're saving people that have had accidents. You're just saving people through surgeries or trauma care. Blood donations are very important. Now, how does that benefit overall your society? If you have more well people around, that's a reduced cost in healthcare overall. So that is it.
All right, we will need to take a short break now. If you're just joining us, give someone a chance. Our special program on Citizen 93.7 FM Abuja. This program is dedicated to promoting voluntary blood donation as an act of compassion and public service. Our guest has been Sinteki Aliu, who is the Principal Scientific Officer, Department of Planning, Research and Statistics of the National Blood Agency. The program returns in a moment. Please don't go away.
Give someone a chance. It is the way to make a difference every single day. Donate blood. Be a true hero. It is what we do. Join us on Citizen FM 93.7 every Thursday at 12:05 p.m. someone a chance. It is the way to make a difference every single day. Donate blood. Be a true hero. It is what we do. Join us on Citizen FM 93.7 every Thursday at 12:05 p.m.
All right, thank you for staying tuned. It's still Citizen 93.7 FM Abuja, and this is our special program, Give Someone a Chance, a special program on Citizen 93.7 Abuja, dedicated to promoting voluntary blood donation as an act of compassion and public service. And our guest is Sintiki Aliu, Principal Scientific Officer, Department of Planning, Research and Statistics of the National Blood Service Agency. The phone lines are open. You can join the conversation. You can call us on 0903 2229797. You can also call us on 0818 2222205. And you can also send us a WhatsApp message if you don't want to make a voice call. Don't forget that you can join our live stream on YouTube, or you listen to us online on www.citizenfm.ng. Sintiki, let's move on now. Let's look at issues of partnerships and public impact. What role do collaborations with institutions and the media, this is one of them that you're doing, and even the private sector play in expanding the reach of this campaign?
Okay, for partnerships are actually key to the sustainability of the agency and sustainability of our blood reserve as a whole. Because partnerships foster awareness, they also get into places that maybe the agency may not be privileged to go into. Additionally, partnerships and collaborations foster robust impact, like the impact to the society is more wholesome in the sense that, for example, I know the agency has an active partnership with NACA. That is the agency that deals with HIV and AIDS. You see, people with HIV and AIDS, it may get to a time when they need blood because of some of their health challenges. That is where we come in as an agency. Likewise, for us as a blood collection center, where we collect blood in our offices, wherever you see a donor is showing sensitivity, because we screen for HIV and the rest, we refer our donors back to NACA. So you see that referral process. From NACA, they now get the care that they need. NACA has a system where they handle people that are maybe positive for HIV and the rest. So that on that front, we also have collaborations with people that have interest in blood research, hospitals. We also partner with all hospitals, aware of if there's any, we have an interdependency kind of thing with hospitals. Where they have blood shortages, they contact our offices where we can supply people in need of blood.
Please,
blood.
just a moment, please. We have a caller here.
Hello? Back again.
Hello?
I just want to ask another question.
Okay, please go ahead. Zainab again on the line. Please go ahead.
You know, I just that they're mentioning that we should donate for free. But you know, when you go to the hospital and then you have a patient that needs blood transfusion, they will normally ask you to pay. Then I'm confused. If we should donate free, and then the person will, when a patient or a brother or whoever wants blood transfusion, they will ask us that we must pay if we cannot, if our blood group or whatever is not the same. That's my question. I'm trying to get, where are they asking us to give them for free? And then when the need arises, they want us
To pay.
To pay. That's what I want to clarify, that issue.
All right. Thank you so much, Zainab. You got the question?
Yes.
Okay.
Yes. So let me just finish
finish
on
with what you were
partnership
saying.
and collaborations. The agency also partners with churches, mosques, and traditional gatekeepers because these are firm and strong institutions that hold the community together. And usually, when we're able to enter these areas, we know that there's greater awareness as well for what we do and what we're about. Now, back to Zainab's question about why there's a monetary, request for blood. It depends. That question is not just a straight. It's not. It doesn't. It can't be given a straight answer. Why? When we, as an agency, go out to get blood, we get the blood and we are getting it from voluntary donors because we believe that you also want to help somebody. Now, when that blood comes to our office, there's a lot that goes into processing that unit, 1 unit of blood. What the financial implication of processing a unit of blood is over 20,000 naira. Now, I can't give you an exact figure. It may be more than that. But as at some years back, that was like how much it cost. Now, where is that cost coming from? Blood bags cost money. Pilot bottles cost money. Cotton wool cost money. Needles cost money. To keep the lights on cost money. And this blood is stored in a blood bank that needs power 24 hours, regardless of your power situation. Reagents for screening cost a lot of money. I don't know if you understand. So what we tag that as is consumable cost. Yes, quite all right. Government subsidized some of these costs for the agency, but it's a subsidy only. Do you understand? That's for our agency. And even at that, the current access fee for blood units is 10,000 naira at the office, regardless of your blood group, be it O negative, A negative, B negative, all the negatives, all the positives, everything is 10,000 naira at the office. If you go to any independent hospital, even a government hospital, I doubt you will get blood for 10,000 naira. Now, why it's being given for 10,000 naira and why even in the office, the nomenclature we use, the word we call is access fee. We don't call it payment because this is just the fee you are getting because this process is subsidized. We're not doing it for profit.
So actually it's subsidized actually because
greatly, and that is why the hospitals are trying to recover. That's why when you go to hospitals, you are told to pay exorbitantly for blood units. Now, what some people do, even me, there was a time I needed blood. Of recent, I had to get from my office at 10,000 naira. But by the time I took it to my hospital, I paid 20,000 naira because the hospital will still insist that they want to run tests on it. So you'd find that even if you want to access from the hospitals, they don't have the procedure of collecting like we do. We go out to collect or we depend on people that walk into the office. The hospitals have their system for how they get their own unit of blood, and they know how much they are spending to process it. So, that is why they are asking for money to be paid. But for us as an agency, what you're paying is an access fee, is greatly subsidized.
All right, our time is fast spent. I wish we had a lot of time to talk about that because this is a very interesting topic. But if you can, in just a minute, what message do you have for Nigerians, especially those listening to us now, and to people who have never even donated blood before? What message do you have for them?
Okay, I would just like to encourage them and to just have it at the back of their mind that blood donation generally is a selfless act. Aside it being selfless, you don't know if your pint of blood might save you, yourself, or your family member. So it's something that we should all endeavor and encourage them. If we can't, we should be blood advocates for people who can't donate.
All right, thank you so much for your interventions on the show today. Senteki Aliu, Principal Scientific Officer of the Department of Planning, Research and Statistics of the National Blood Service Agency. It's been a pleasure to have you on the show.
It's been a pleasure too. Thank you so much.
All right, you have been listening to Give Someone a Chance on Citizen 93.7 FM Abuja, a program sponsored by the National Blood Service Agency and dedicated to building a culture of safe, voluntary blood donation across Nigeria. Remember, every pint of blood you give could save a life. Someone somewhere is waiting for that chance. Be the reason they get it. Join us next time And until then, don't just think about saving lives. Give blood, give hope. Together, we save lives. I am Lawrence Omoite. Coming up next is Labour Forum by veteran Labour activist Anthony Ogbeagwon.